Hello, good morning to one and all. This is Dr. Arun Kumar Arasappa, a consultant cardiac and thoracic surgeon practicing cardiac and thoracic surgery for the past 15 years in India and also a practicing physician for the past 2 decades. Now, in this video, I would like to give you some insights about COVID-19 infection, about the infection, how it happens, and what the general public needs to know. So, I will be discussing this mainly for the medical students as well as for the general public. So I would like to divide my presentation in three different phases. Like the first phase is the infection, how it happens. The second phase is otherwise what we call as the immune phase, or what happens to the immune system in the body. And third is called the phase of complication, or what happens after COVID-19 infection goes away from the body. So in order to understand this, first let us understand about the virus, how it enters in the body, and how it manipulates inside the body cells, and how it creates infection. So this coronavirus, as you take, is a virus called SARS. It belongs to the group called SARS virus, and it's called as systemic acute respiratory syndrome virus, or it's otherwise called as SARS-CoV-2. And this is again a respiratory virus which has a predilection towards the respiratory system mainly, but of course it now involves the gut system also. So what happens when this virus enters into your body? Now when the virus enters into your body, what is the route of transmission? As we have understood for the past 1.5 years about this pandemic, the route of transmission is aerosol initially, like we thought it's going to be like fomites and objects where the virus falls by the droplets, and when the other person comes in contact with this, gets the infection. But recently it has been proved by various studies that it is not only the aerosol, but this virus can be transmitted through air, otherwise it's called as an airborne transmission. So when the virus is there everywhere, so the virus is there everywhere. So when the patient or a person with this COVID infection sneezes or coughs or even talks aloud or sings in the public, the next person who comes in contact with this person gets this virus through his respiratory tract, which starts from the nose or mouth. It goes and gets lodged into the throat. In medical terms, we call it as a pharynx. So once it goes into the pharynx, these viruses have certain proteins which have specialized predilection towards receptors on the cells, particularly pharyngeal cells. They go inside the cells and they start multiplying, making use of the cell machinery. And this is what we call the replication of the virus. So the virus replicates into millions and millions of copies of the viruses. So ultimately what happens, this virus, as you know, is a foreign body. The immune system senses immediately and tries to attack this virus. So during this phase, this initial phase, how does the patient present? The patient presents with complaints of itchy throat, some sore throat, and some people will present with headache, fever. Some patients present with conjunctivitis. Some patients present with loss of taste, loss of smell, and of late patients also complained about diarrhea or passing loose stools. So what happens? This infection is now marked with a rise in body temperature. So the patient can have a temperature ranging from mild temperature, for example, something around 99 degrees Fahrenheit to 100 or 101 degree Fahrenheit. So this is the acute phase, or this initial phase, stage 1, where it will last for about 3 to 5 days on an average, 3 to 5 days. So this we call as the incubation period, like the time between the entry of the virus and the presence of symptoms. So this marks the first phase. Now this passes off. Most of the patients will pass off this phase, and I would say like around 75 to 80% of the patients will pass on with this and they become alright. But some 20%, 15 to 20% of the patients, they will take a different turn. For example, this virus will leave behind certain proteins, for example the spike proteins, which is very famous for this coronavirus. and our own body, our own immune system recognizes this as a foreign body, and particularly these kind of receptors which recognizes are there in the vascular system. Unfortunately, they match with the viral proteins. So what happens? Our own defense systems and antibodies senses this. Our own cells, that is the cells inside the vessels, senses as a foreign body and tries to attack it. And when this it comes into the picture, what we call it as the release of certain enzymes, certain factors which we call as cytokines. So this cytokines, when it happens in a large scale, mass scale, it is called as cytokine storm. It's called cytokine storm or cytokine showering. So what happens? The patient presents now with severe myalgia, fever, and then there's also rise of certain parameters, blood parameters, which we call it as the C-reactive protein, the LDH, ferritin, and the D-dimer. So when these gets elevated, it gives us a clue that this patient is going for a different route of progression of the disease. So at this point, what we do after investigating, simple way, clinically we investigate with temperature, bedside, and also oxygen saturation. When we take the oxygen saturation, we classify patients based on the oxygen saturation. Any patient who is going to have more than 95% of oxygen saturation at room and we label them as mild disease with positive infection. So anyone who is going to have below 95 or 94 percentage of oxygen saturation, we label them as the moderate infection. And anyone who is going to go below 90%, we term it as severe infection, along with other parameters, that is the blood investigations, and we take what is called as a CT of the chest to see how much percentage of the lung is getting involved. Now one thing is very clear, we have to make it clear. The problem which happens in lung during this second phase of the disease is not a pneumonia. It is a disease of the vessels, particularly the lung vasculature, the pulmonary arteries. They get clogged with clots, and there is a problem with the flow of blood through the pulmonary vasculature, and there is a problem with the gas exchange which can happen because of the clotting of the blood in this. So basically we have some units in lungs called alveolar units. In this alveolar units, there is a mechanism called the diffusion of gases. So as you take oxygen, that is the oxygen from the atmosphere, which is called inspired oxygen, you have only 21% of oxygen and the rest of this nitrogen. So this percentage of oxygen which comes from the atmosphere goes into the lungs and goes up to the level of alveoli, and the blood, which is the deoxygenated blood we call, or the blood which has less of oxygen and more of carbon dioxide. That exchange takes place at the alveolar membrane level, where the carbon dioxide is getting into the lung side and the oxygen from the lung side is going into the blood. So this is the normal mechanism. So when there is loss of diffusion or loss of exchange taking place because of the clots in the blood vasculature, even though the oxygen is okay from the lung side, there won't be any gas exchange, and this is the point of time where the patient will develop difficulty in breathing, or called dyspnea in medical terms. So once they get developed, now it depends upon the severity. So at this point of time, the patient needs some support externally, which is called oxygen therapy. So mind you, in the acute phase or the stage 1, the patient doesn't require oxygen. So in the stage 2, the patient goes for oxygen requirement. So we give oxygen depending upon the saturation of the patient. We give oxygen various methods, like we can give nasal prongs, or we can keep mask, or in worst situation we can go for a high flow oxygen, nasal oxygen concentration, and in still worse conditions we go for a positive pressure ventilation and ventilation, or put the patient on ventilators. So that is an extreme stage. So up to this stage, the main treatment goal is to give oxygen for the diffusion to take place and the gas exchange to take place normally. Then, because of this cytokine which is getting released in the system, because of the acute inflammation happens, there are certain drugs which helps in reducing the formation of cytokines or reduce the effect of the cytokines, and that drug is called as the age-old drug called steroids. So these steroids will prevent the cytokine release, and it will reduce the damage which can be caused by the cytokines. But at the cost of what? The steroids have its own side effects. So steroids, if you take, can alter your fluid and electrolyte imbalance. It can affect your kidneys if you have a borderline kidney disease, and more so in patients with diabetes. It can change a patient from a pre-diabetic area into a fully blown diabetic, or it can be it's a diabetogenic drug. So you have to judiciously use steroids, not in the first phase, but in the second phase when the cytokine storm is going to happen. Now, again, the third line of management is giving blood thinners, because these clots, you are supposed to lyse these clots with drugs called blood thinners. So, blood thinners are nothing but heparin, which we classify as unfractionated heparin or low molecular heparin. Either of them should be used to lyse the clots which have already happened. So, once these things are given as a treatment, so patient becomes symptomatically improved. So, what's the duration? Usually, steroids are given not more than 10 days, 7 to 10 days, and the blood thinners are given at least for about a period of 2 weeks for the clots to get lysed. Yes, so this is the phase where you treat the patient in hospital. Like in the first phase, I can say the patient can be treated in home quarantine. Under the supervision of the physician, you can get all the medications, like basic medications like paracetamol for fever. Usually we give 500 milligram 4 times a day, and then you can give vitamin supplements like vitamin C 500 milligram per day, vitamin zinc, B complex vitamin, and certain other vitamins like vitamin D, which can be given in the first phase. So in the second phase, I told you, we give oxygen, blood thinners, and steroids. Now once this gets over, patient recovers, patient comes to the normal ward or to home, the patient can have what is called slowly developing a post-COVID syndromes. So for example, since a patient is on steroid for a long time, the patient can go in for a diabetogenic status, and the patient can have very rarely, which is happening in India, patient can develop opportunistic blood infection, bacterial infections, and fungal infections. As everyone have heard about what is happening, it's called the black fungus or mucormycosis, which can happen because of two reasons. That is, one, the excess use of steroids. Two, in case of usage of oxygen for a long time, when the patient is given oxygen in a humidifier which is not washed properly, or sometimes washed in tap water, this black fungus, which is again a commensal, can get into system because your immunity is getting weakened, to one by the disease, two by giving steroids. So this is the post-COVID sequelae. So these are the things which you have to keep in mind during this pandemic. First and foremost thing is, once you get infected, most of the people have a doubt what to do. Your test comes as positive. Don't get panicked. First point is, don't get panicked. First, now you see what are the symptoms you have. Do you have symptoms or no? So you classify them as symptomatic positive patients or asymptomatic positive patients. So symptomatic positive patients, treat the symptoms. If the saturation is good, you can give a home remedial measures, as I already told you, and you can be in isolation, move a little away from your relatives, kith and kin, be in isolation for a period of at least 7 days, and then you become alright. Or during this isolation, if you develop symptoms like difficulty in breathing and your saturation level drops, that's the time you cannot stay in the house. You have to step outside, go and visit a physician, go and get admitted in a hospital, and then the treatment starts from there. Never try to give oxygen at home. Don't make this as a habit of giving oxygen at home and I can manage everything. And never use steroids by yourself. All these are dangerous practices of medicine, and this is what is the problem happening in India. People try to self-medicate. They say that I can take in, my own friends, many of them have told that I've taken steroid, I've taken this much steroid, I've taken antibiotics like this. All these things are not going to help. You are supposed to go to a hospital, try to get a physician, and under his guidance you will be getting treated. So this is what I want to just share during this period of pandemic. So don't overtreat and don't undertreat the disease. Learn something about the disease and spread positivity of how to cope up with the disease. And I can definitely say we are going to pass this disease and we are going to live healthily in the future. And before I conclude, an important note: vaccines. Vaccines are a powerful tool during any pandemic, and it's very good that all countries have come together to produce vaccines for the whole community. So, as far as possible, try to get vaccinated as early as possible and try to make two vaccinations. That is, a first jab and second jab. We call first vaccine, second vaccination. The duration depends upon the government policy. So try to get vaccinated as early as possible, because vaccines are nothing but a small subtle infection which primes your immune systems to act against any possible future infection by the same organism. So there is a basic principle behind vaccines, and as you all have read or known by how vaccines eradicated polio, how vaccines eradicated so many diseases in this world. So we are just trying with this vaccine as an important tool to bring down the disease or to control the disease. And not the last, not the least, most important thing is you are supposed to do a social distancing, wearing a mask in all public places, and sanitizing, that is washing your hands, and keep ourselves clean. Not only us, by environment also. So take care, and my best wishes for speedy recovery for all those people who got infected. And we are available over the net, over the phone, over WhatsApp. And any person who wants to get more information about that, we are always there. We are welcome with your questions. We are there ready to answer. So thank you friends for watching this video. Have a great day. Bye.